Telehealth and Homecare Global Service Platform Deep Dive Analysis Q1 2025 Report Executive Summary. In Q1 2025, telehealth and homecare platforms are reshaping global healthcare delivery, transitioning from reactive, facility-based systems to proactive, decentralized, and value-based care ecosystems. No longer limited to virtual consultations, these platforms now enable comprehensive, high-acuity care at home, offer AI-enabled care orchestration, and deliver personalized longitudinal health services across physical, mental, maternal, and chronic care domains. This report presents an evaluation of 70 service platforms across 11 countries: Belgium, Bulgaria, Canada, Finland, France, India, Israel, Sweden, Switzerland, the UK, and the USA, using the proprietary AI agent-powered digital health evaluation platform. Each solution was assessed across 4 equally weighted dimensions: patient engagement and experience, integration and interoperability, regulatory compliance, and clinical effectiveness, to determine their alignment with value-based care principles and their ability to scale across global healthcare systems. Solutions were scored from 0 to 10 in each category, with average scores used to classify platforms into top tier, 9.0 to 10.0, second tier, 8.0 to 8.99, and third tier, 7.0 to 7.99. The findings highlight a maturing sector with a growing number of highly integrated, personalized, and evidence-based service models that are driving healthcare access, equity, and efficiency worldwide. 1. Evaluation framework. To ensure rigorous and consistent assessment, the following 4-level framework was applied. Level 1, patient engagement and experience, scored for usability, personalization, and education support tools, with particular attention to accessibility for elderly patients, non-English speakers, and those with low digital literacy. Level 2, integration and interoperability, focused on air compatibility, data standard compliance, HL7, FHIR, platform adaptability, scalability, ease of clinician use, training support, cost of ownership, and ROI impact. Level 3, regulatory compliance, assessed adherence to HIPAA, GDPR, CE, and FDA standards, along with cybersecurity protocols, clinical safety measures, and certifications. Level 4, clinical effectiveness, measured evidence-based health outcomes, real-world clinical deployment, and safety performance, with high scores reserved for solutions with peer-reviewed or regulatory-endorsed validation. Each platform's average score across the 4 levels determined its final tier placement. 2. Top-tier solutions, 9.0 to 10.0. 22 platforms emerged in the top tier, demonstrating industry-leading excellence across every metric. These platforms offer deeply integrated, evidence-based, and highly scalable models of virtual and in-home care. Key exemplars: Medically Home, USA, a pioneer in hospital-at-home infrastructure, delivering acute and post-acute care with remote diagnostics, real-time logistics, and CMS-aligned payment models. Its Seizure orchestration platform, used by Mayo Clinic and Cleveland Clinic, showcases gold standard interoperability and patient outcomes. Maven Clinic, USA, the largest virtual women's and family health platform globally, integrating fertility, pregnancy, parenting, and menopause care. The platform leverages Maven RX, Maven Wallet, and a network of 30+ specialties to provide culturally competent, longitudinal care, backed by employers and payers. Monogram Health and MyLaurel Health, USA, leaders in chronic and high-acuity home care, with robust predictive models, care teams, and value-based payment structures. Both platforms demonstrated strong engagement, safety, and financial ROI metrics. Cry, Sweden, and Sensi.ai, Israel, top-tier non-US leaders. Cry offers national-scale digital and physical services across Europe, integrated with public health systems. Sensi.ai provides AI-enabled eldercare surveillance, offering privacy-preserving 24/7 monitoring with seamless care team alerts. Talkiatry and Spring Health, USA, driving scalable mental health access. Talkiatry's fully virtual psychiatry platform streamlines access and medication management. Spring Health matches patients with personalized therapy and coaching, backed by multinational employers like Microsoft and Target. These top-tier platforms are defining the next generation of distributed, tech-enabled care delivery, offering seamless integration, clinical depth, and economic value across public and private systems. 3. Second-tier solutions, 8.0 to 8.99. Over 40 solutions fall into the second tier, demonstrating solid performance and market maturity, often excelling in niche categories or geographies but requiring further clinical validation, technical optimization, or regulatory expansion. Highlight Sera, UK, and Birdie, UK, strong performers in home elder care and digitally enabled caregiver coordination. Both platforms emphasize personalization, medication adherence, and SDOH engagement. Oshi Health and Salvo Health, USA, virtual GI and metabolic health clinics combining dietetics, behavioral health, and specialty consults. Scored highly on patient engagement and personalization, with potential for broader payer alignment. Doctolib, France, MinDoctor, Sweden, and Healy, Bulgaria, regional leaders in teleconsultation and air-integrated scheduling platforms. Doctolib showed high scores for regulatory compliance and clinician usability. Papa, USA, and Care, Israel, address social health and isolation within home visits, peer support, and tech enablement, key components of whole-person care models. Visana Health and USA, specialized in culturally competent, digitally scalable mental health care across populations underserved by traditional models, including students and Medicaid enrollees. Many second-tier platforms exhibit strong technical usability and care model innovation, but require expanded clinical trials, payer integration, or global regulatory positioning to reach top-tier readiness. 4. Third-tier solutions, 7.0 to 7.99. Third-tier platforms are often early-stage, regionally confined, or narrow in scope, with lower maturity in clinical validation or system integration. However, they offer significant potential for targeted innovation. Examples: Alma Care, Belgium, and WeHelp, France, offer quality elder care services but scored lower on platform interoperability, data standards, and clinical evidence. Best Doctor, India, an accessible, mobile-first teleconsultation platform with potential to scale across underserved markets. Currently lacks strong regulatory infrastructure or validation. Lemonade Health, USA, and Dr. House, USA, on-demand virtual clinics offering fast access and consumer convenience. Scored lower in clinical rigor and integration with provider systems. These platforms may benefit from strategic alignment with accelerators, academic medical centers, or regulatory roadmaps to mature into scalable care delivery tools. 5. Strategic trends and insights. Several key trends define the current state and trajectory of the global telehealth and home care platform ecosystem. Hospital-at-home normalization. Platforms like Medically Home and MyLaurel are proving that acute, high-acuity care can be safely and effectively delivered in patient homes, supported by logistics, real-time monitoring, and remote physician oversight. AI-powered navigation and support. From MyLaurel's conversational AI assistant to K-Health's predictive triage engine, AI is powering smarter patient journeys, care coordination, and clinician support. Global maternity and women's health leadership. Maven Clinic, Cayaba Care, and Visana Health represent a growing class of gender-responsive platforms offering longitudinal support from fertility to menopause. Mental health at scale. Solutions like High-acuity, Spring Health, Valera, and are addressing care gaps with fast access, AI-driven matching, and outcomes-based employer partnerships. Social determinants and home companionship. Companies like Papa and are redefining care delivery by tackling isolation, transportation, and tech literacy, core issues in equitable healthcare. Virtual specialization and longitudinal models. Platforms like Oshi, Synapticure, and Reimagine Care deliver condition-specific, team-based virtual care that mirrors traditional specialty clinics. Decentralized, globally distributed operations. Non-US leaders like Cry, Doctolib, Evandos, and VisibaCare showcase models aligned with national payer systems, digital infrastructure mandates, and GDPR-compliant operations. 6. Strategic recommendation. Top-tier platforms should continue global regulatory expansion, pursue payer integration across markets, and extend their models to underserved geographies. Second-tier platforms should prioritize clinical validation studies, payer-aligned business models, and international regulatory roadmaps, e.g., CE, DIGA, NHS Innovation Accelerator. Third-tier platforms should focus on niche high-impact populations, public-private innovation partnerships, and clinical safety and air integration to improve scalability. Conclusion: Telehealth and Homecare platforms are no longer auxiliary services. They are central pillars of modern, distributed healthcare. The Q1 2025 analysis confirms a rapidly maturing landscape in which platforms are delivering hospital-grade care, longitudinal chronic condition management, and personalized mental and maternal health services, all from the comfort of a patient's home. With AI-powered orchestration, regulatory readiness, and payer-aligned value models, the top-performing platforms in this report are laying the foundation for a digitally native, patient-first health ecosystem that prioritizes access, equity, and outcomes at scale. As the global demand for hybrid, scalable, and preventive care continues to rise, these platforms will shape the architecture of value-based care delivery for the next decade and beyond.